We're so excited to share these results with you all, and so wanted to welcome you to this Commonwealth and EB&M webinar, Good for Business, Turning Workplace Benefits into Financial Win-Wins. My name is Nick Maynard, Senior Vice President at Commonwealth, and really happy to have such a great group of folks here to engage with these results. Today, we'll set the stage with a look at intentional workplace benefits and Commonwealth's new National Survey of Workers earning low to moderate incomes, and Charles will take us through that. The folks joining me on the panel later, Nancy Weiss, Senior Director of Financial Benefits at AutoNation, Ricarda Ganjam, Senior Director of Work-Life Solutions at Marriott International, and Tracy Watts, Senior Partner, National Leader for U.S. Healthcare Policy at Mercer. So a really great group to talk about what you hear today. We'll do some panel conversation and then get to some Q&A. For those of you new to Commonwealth, Commonwealth's a national nonprofit with a mission to make wealth more common, especially for those earning low to moderate income and underserved populations. We focus on workers juggling lots of responsibilities and their lives and their employment, and with lots of challenges related to savings, debt, maybe paying for child expenses, etc. And we're really determined to build their financial health and wellness. So by 2027, Commonwealth has a real broad strategic vision to impact 10 million families and build 15 billion in wealth through the workplace, through the financial services system, and through technology-driven solutions. This conversation lives focused in our workplace area and thinking about those workplace benefits that can really be intentional and inclusive for workers that are in need of that financial wellness. One of our key partners in the work for Benefits for the Future is Bernadette Bernowski, and she's the Global Benefits Manager in Human Resources at JPMorgan Chase. So I'll turn to Bernadette to set the stage for us as we begin this conversation.
Thanks, Nick. Hi, everybody. I am delighted to welcome you to today's webinar and honored to be joined by so many leaders and innovators across the country who are dedicated to shaping the future of workplace benefits and the financial health of our employees. At JPMorgan Chase, and probably at many of your companies as well, which is why you're here with us today, we believe that the strength of any organization lies in its people. And we also know that when employees feel financially secure, they're empowered to bring their best selves to work, driving productivity, engagement, and long-term success. Financially secure workers are also more likely to stay with their company, which can improve retention, boost morale. Both of these things lend themselves to financial benefits for employers as well. We're proud to support Commonwealth's Benefits for the Future initiative, an investment that reflects our belief in the power of cross-sector collaboration to help drive meaningful change for working Americans, including those earning low and moderate income. Our partnership with Commonwealth is rooted in a shared dedication to research, innovation, and impact. And through this initiative, we're supporting pilots and studies that can help employers design benefits that help meet the needs of their workforce. As we look ahead, it's clear that the challenges facing workers, including those earning LMI, require new approaches and deeper collaboration. And we know that for millions of workers, financial stability can not only be supported by wages, but also by access to robust employer-sponsored benefits programs. Yet research shows that fewer than 1/3 of workers have access to benefits that can help them weather financial shocks and support wealth-building goals for the future. This gap not only affects individual families, but also costs our economy billions in lost productivity. So by working together to integrate these resources, we can help employees build resilience, navigate unexpected challenges, and plan for the future. When companies invest in benefits that address real in-demand financial needs, whether it's emergency savings, retirement planning, or access to financial coaching, they can see measurable improvements in retention, morale, and overall business performance. But this isn't just about business outcomes. It's about building a culture of care, understanding, and resilience. And this work builds on JPMorgan Chase's holistic efforts to help improve financial health outcomes. We provide a variety of benefits to our employees, ranging from 401k retirement plans, to employee stock purchase opportunities, to unlimited one-on-one financial coaching sessions, and access to affordable healthcare coverage. And we hope that by continuing to share our collective experiences and insights, we can help strengthen the financial health of employees everywhere. And that's why today's conversation is so important. It's an opportunity for all of us to learn, share, and imagine what's possible when we put employee financial health at the center of our benefits strategy. So I encourage you all to engage with the panelists, ask questions, and consider how your organization can be part of this movement. So once again, thank you for joining us, and thank you for your commitment to building workplaces where employees and businesses can thrive. And now I will turn it over to Charles.
All right.
Well, before then, I'll just say thanks so much, Bernadette, and really appreciate your JP Morgan Chase's commitment to this vital work and to the commitment around financial health being at the center of inclusive benefits. So now, Charles, it's time. Let's dive into the survey. This is Charles De La Cruz, our Associate Director, who's been a real leader on this work and looking into tackling this issue of benefits that employees want. So over to you, Charles.
Sounds good. Thanks, Nick. So, as I was saying, intentional workplace benefits can become financial win-wins for employers and workers, and our work reaffirms that fact every day. So this afternoon, we're here to share some key insights from Commonwealth's recently published national survey of workers earning low and moderate incomes, or LMI. And we're going to talk about solutions we can all benefit from. But first, let's set the stage with an understanding of where we all find ourselves in this workplace benefits and financial health landscape. Commonwealth's Benefits for the Future initiative was built around one central truth. When employees are financially, mentally, and physically well, so is the organization. And as benefit leaders, you know employee well-being is directly tied to retention, productivity, and morale. Yet financial wellness is often the missing link or the underutilized tool in our toolbox. Right here on the screen, the numbers pop out. Employees report losing 7 or more hours of productivity each week to financial stress, which amounts to $183 billion in lost productivity each year. 74% of employees report being likely to leave for better financial benefits, and 80% of employers agree financial wellness support can result in more satisfied, loyal, engaged, and productive employees. The bottom line is that worker financial security has a profound impact on employers' bottom line, and employers have an important role to play in addressing worker financial insecurity. Employers spend trillions of dollars annually on workplace benefits, yet many workers don't have access to or aren't taking advantage of workplace benefit opportunities to reduce financial hardship. Here's our opportunity with intentional workplace benefits design and communication. The opportunity to increase uptake, satisfaction, and employee retention. So Commonwealth asks, what makes a financial benefit truly move the needle for both employers and employees? This led us to examine what we call an intentional benefit. And drawing on Commonwealth's decades of experience, we've identified 3 central characteristics. First, they're outcome focused. That is, they're focused on improving workers' financial confidence and lowering stress while unlocking business results in a measurable way. Second, they're responsive, designed for the needs of employees earning up to about $80,000 annually, who face different realities than higher paid staff. And third, they're additive, enhancing health and retirement benefits by adding features or enabling greater use and effectiveness. So with that said, let's take a moment to set the stage and elevate your voices in this conversation with a quick poll, which our partners at EBN will queue up now. All right, so our first poll today is, which of these challenges is top of mind for your organization when it comes to increasing benefits enrollment or usage? The options are underutilization of current benefit offerings, lack of worker awareness or understanding of available benefits, lack of insight into worker needs and benefit priorities, and uncertainty on the ROI amid budgetary constraints. So we'll give a minute or so for people to put in their votes, and then we'll discuss. All right, I think that's about enough time. Let's look at some of the results. All right, it's looking like uncertainty on the impact and ROI of existing benefit offerings and lack of worker awareness or understanding of available benefits are the top 2 options today. These are serious issues. They're things that we are addressing through BFF. I think that doing demonstrations to really measure the impact of existing benefit offerings and new possibilities is really going to be key to driving wider uptake. So that's a really important project. We also see persistent issues with communication in our research as well. So that makes a lot of sense with the lack of worker awareness. And we will later be discussing what that might look like, these communications preferences. All right, thank you so much for participating in our poll. I will move on now to a discussion of our national survey results. Earlier this year, we surveyed 2,054 respondents earning under $80,000. Our results feature significant samples from 7 key industries: food service, retail, hospitality, healthcare, manufacturing, delivery and transportation, and financial services. What that means is that we can go back into this data set and cut it so that we can look at any one of these industries individually. If you're interested in that kind of information, please reach out to us later. Next on the results. Access to a robust suite of benefits beyond healthcare and retirement clearly remains limited for LMI workers. These supplementary benefits can play a key role in supporting worker financial health and facilitating long-term savings. And as you can see, there's a big drop-off in access outside of healthcare and retirement benefits, and another large drop-off after the various forms of leave. For most of these benefits, less than 1 in 10 workers has access. This is a major opportunity for employers to increase worker financial health, retention, and job satisfaction through improving access to additional workplace benefit options. What we see here is that rising cost of living has meant that many American workers struggle to keep up with monthly expenses. We asked respondents about their financial priorities, and survey results show that building savings is a top priority for workers earning LMI, with 4 of the top 5 financial priorities being savings related, including retirement, emergencies, cost of living increases, and other long-term financial goals. And workplace savings programs are among the most desired workplace benefits in our survey as well. So here's a clear space where workplace benefits can provide a win-win for workers and employers, building a more resilient workforce for employers. All right. In addition to asking about which benefits they had access to, we asked workers about which benefits they felt would be most valuable to them personally. After better paid and medical leave, the top choice among LMI workers was workplace-based emergency savings accounts. Despite only 9% of workers having access to these accounts, 25% listed them as one of their top 3 most valuable benefit options. There's also a strong interest in workplace-based investing accounts, with 20% selecting employer matches for an investing account as a most valuable benefit. CHROs know that they have a role, but need actionable ROI-driven models and added resources. That includes non-biased expertise, research, impact measurement, and cost reduction. Based on this data and Commonwealth's more than 20 years of experience working with employers on benefit solutions, we see several areas where benefits offerings can better meet the needs of their employees, and in turn improve business outcomes for employers. We don't have time to cover all the areas of opportunity today, but for now, I want to focus on 4 that really stood out from this research: retirement, 529s, health costs and medical debt, emergency savings, as we just discussed, and communications, which is essential to all of these. Access to retirement savings benefits through the workplace is a cornerstone of worker financial health. So let's start there, where we still have notable access gaps. Despite retirement savings being at the top of the priority list, only half are currently participating in a workplace retirement program, and slightly over 1 in 5 have no access at all. Of those that have access to a retirement account, 20%, 27% still don't use it. Increasing retirement savings is a systemic challenge and can be supported not just through direct focus on retirement benefits, but also on a range of supplementary benefits, including 529s, emergency savings accounts, and health benefits that prevent retirement leakage or make it easier to consistently save towards retirement. Next, let's take a look at educational savings, 529 accounts. Employers provide a key channel for 529 account creation. Overall uptake remains low, with just 9% of LMI workers having a 529 account. But what we found in our survey is that 77% of LMI workers with 529s open them with support or guidance from their employer. That reinforces what Commonwealth found in an earlier study in 2024, that 96% of parents who did not have a 529 plan expressed interest in opening one if it was offered as a workplace benefit. This reflects the impact of the employer's role and influence on employees' financial health and actions taken as a result of the knowledge, education, and communication shared from the employer. 529 accounts present a vital tax advantage savings opportunity that employers can play an important role in driving. Recent legislative changes have also expanded the qualified expenses eligible under 529s, including vocational skills and some rollover into IRA accounts. These changes may make 529s an even more desirable benefit for employers moving forward, providing some additional flexibility and insurance for savers, and making 529s useful beyond saving for college. Although healthcare benefits are critical to financial health, only 57% of our sample of workers earning LMI were enrolled in healthcare benefits with their employer. 29% said their employer did not even offer health insurance, and 19% said they could not afford the cost of the employer's plan. Across the board, we're seeing the rise of HDHPs, high deductible health plans, which can reduce the upfront cost for participants and do provide access to a tax-advantaged health savings account. However, these plans can present a risk for LMI earners, who can be confronted with a deductible reaching into the thousands for medical care. 40% of our survey respondents hold medical debt. However, what we found is that the majority of this medical debt is under $5,000, suggesting that the cost is not insurmountable and could be mitigated through benefit solutions. These findings underscore the importance of providing seed funding and employer contributions to HSAs as an incentive to ensure that employees who select HDHPs enroll in and make use of their HSA. Finally, communication. You can't adopt a benefit that you don't know about. Half of respondents in our survey wanted more frequent benefits communications from their employer, which is a low-cost opportunity to increase benefits utilization and support employee financial health. For example, 18% of respondents said they had not seen or received any benefits information from their employer in the last year. So what's working in communications? In general, email and paper mail are preferred for benefits communications. New technologies, such as more advanced large language models, or LLMs, could also provide opportunities to significantly improve and personalize benefits communications. All right, with that said, we are going to take a moment now to conduct our second poll and hear from you all. So our second poll is, which of these benefits do you think your organization would be most interested in introducing? Your 5 options are retirement savings, workplace emergency savings accounts, health savings accounts, HSAs, 529 education savings accounts, and student loan payment support. We'll give you all a minute now to submit your answers. All right, 15 more seconds. All right, let's see the results for this one. Okay, looks like workplace emergency savings accounts are dominating the voting, which I love to hear. We are all about emergency savings accounts. There's actually recently a really interesting publication from Financial Health Network. I'm not sure if you all have encountered it, but it found that workplace emergency savings accounts are one of the most financially impactful benefits for workers as well. So this is a great opportunity, and I'm so glad to see the enthusiasm around this. All right, a few more slides to go. So we all have an opportunity to advocate for and lead in our organizations for more intentional workplace benefits. After all, intentional workplace benefits are a win-win. They provide improved financial security for workers and positive business outcomes for employers. Strong workplace benefits make for a stronger workforce on several fronts. attraction, retention, engagement, productivity, and the recipe for a win-win success is coming into focus. Two-way communication with employees, innovation, incentives, and a systemic approach to offering benefits. These are all key to maximizing impact of benefit initiatives. That brings us to the Benefits for the Future initiative, Commonwealth's ambitious multi-year effort supported by JP Morgan Chase that will partner with forward-thinking employers to pilot and scale innovative, high-impact employer benefit programs to improve the financial health of 2.5 million workers annually. This expands access to intentional workplace benefits that are outcome-focused, responsive, and additive, and draws on Commonwealth's 20-plus years of experience with employers and benefit providers. Commonwealth provides technical expertise, consulting, and design assistance to leading employers of hourly and LMI earners. This is a no-cost opportunity for firms seeking to drive employee retention, satisfaction, and productivity. Now, for an example of what this looks like, we have a case study from UPS, which is a firm that we collaborated with recently on emergency savings. So UPS recognized the need for emergency savings amongst employees. So Commonwealth and UPS collaborated to develop and communicate an emergency savings benefit to their 100,000 non-union employees. Faced with an organizational budget constraints and operational constraints, together we sought to address the needs of wired and non-wired employees in this environment. Using Commonwealth's best practices, we worked together to develop an employee communication strategy and materials, along with targeted research and analysis that led to $15 million in new savings, an overarching positive impact on retirement savings, and increased employee awareness in the form of 23,000 landing page visitors in 1 year. This work contributed to broader industry recognition of the benefits of emergency savings, with adoption of this benefit continuing to grow since this work was completed. Major policy developments through Secure 2.0 have also made it easier for workers to access emergency savings pockets connected to their retirement accounts. All right. Thank you so much for joining me for this discussion of our research. I will now pass it back to Nick to guide us further.
Thanks, Charles. Really appreciate that walkthrough of the national survey. It's super exciting to see this data, and it builds on a lot of data in the larger ecosystem about workplace benefits. So want to turn now and bring our panel into the conversation and to engage with some questions and reflect on what we've heard about the intentional approach to having impact. So I'll just reintroduce everyone again. There's Ricarda, Tracy, and Nancy, who introduce themselves as they go along in their organizations with their answers. And as they all get on screen and so forth, I'll dig into some of our questions. So let's dive in. Nancy, starting with you, and then Ricarda, I'll come to you after Nancy. As our national survey shows, today's workforce experiences a variety of different financial stressors and challenges. What financial challenges are you hearing most from your employees that keep them from fully being present and productive at work at AutoNation?
Yeah, thanks, Nick. Well, we've not really done any extensive sentiment research among our associates in this area. However, Commonwealth has conducted surveys and in-depth interviews among our associates who have taken advantage of our emergency savings program and have also taken advantage of the $1,000 family emergency provision of Secure 2.0 that we implemented last year. And the most common financial stressor that employees cited when taking this emergency withdrawal was an increase in cost of living expenses, which really on their own didn't seem to necessitate a withdrawal from retirement. But when Commonwealth dug deeper into the interviews with these employees, that we learned that these cost of living increases really disrupted their regular budgeting process, and then in turn reduced their capacity to handle unexpected expense shocks. So the next most common emergency expenses that employees faced were medical expenses and car repairs. And while, of course, AutoNation could help easily with the car repairs, we know that the effects of these kinds of shocks are often really amplified by the broader cost of living increases that are, squeezing household budgets today. But the really good news is that all of the associates that were interviewed expressed really relief knowing that if they do have financial challenges, they have a safety net to fall back on. And they noted that this source of financial security reduces their stress and allows them to concentrate on what's important, be that at work or at home.
Nancy, that's super helpful, and it's great to hear that there's sort of a shift in ability to focus and reduce that stress that can bring sort of a sense of mental well-being along with financial wellness. Ricarda, turning to you and Marriott, your thoughts on the financial challenges and stressors that you all are seeing, or how you're thinking about these?
Sure. Thank you, Nick. And I'll just say this is something that we are intentionally pursuing to better understand at Marriott International right now. We recently completed a pulse survey focused on our LMI associates, and we're in the process of conducting focus groups with Commonwealth to dig deeper. I can share a few themes that are already surfacing and that we're hearing about and seeing through other data forms as well. And I think many of these echo what Nancy was talking about as well. First, just a lot of short-term financial fragility, where we have our associates are frequently sharing that they don't have enough money saved for emergencies, which then creates constant background stress and distraction. We've seen that people have pulled money out of their 401ks to support emergency spending, really, many times, and taken out those loans there. We are also seeing that rising day-to-day costs are impacting our people, those everyday expenses that Nancy was also talking about, including, housing, transportation, groceries, all sucking up bigger portions of people's paychecks and really leaving very little room for them to establish any savings along the way. And so, of course, with that, if they don't have savings, people are worrying about retirement and also healthcare costs in retirement, as we all hear that those healthcare costs are continuing to increase. So I'd say, overall, people are worried about covering their basic expenses and planning for the future, and that this can be a distraction for people when they're trying to figure out how they're going to make ends meet and how they're going to survive long term. And that can have negative impacts on their ability to be fully present at work and productive at work. One other thing I just wanted to chime in on was that as a global company, we also hear that, what might work in the US and Canada may not work in our other continents, and that we really need to have very specific target local strategies. So that's a little bit of what I'd share, Nick.
Thanks, Ricardo. That's super insightful, and it's very common to. It sounds like you and Nancy are seeing very similar things across each of your organizations, which is not surprising. I assume many people listening to this are familiar with a lot of these financial stressors that workers are faced with. Tracy, turning to you and thinking, zooming out a little bit, given the view that Mercer has across many employers and many organizations. What have you learned about the relationship between employee financial wellness and business outcomes, and what echoes from this conversation so far? Oh, so, Tracy, you're still on.
Yes. So first of all, I just want to commend Commonwealth for all of the great work that you do to support financial well-being. Just love your research. This most recent piece is fabulous. And certainly this is a really important topic. And I think, to address it, we really need to meet people where they are. And so having this kind of research is just, of utmost importance for us to be able to think more broadly. We all have anecdotes from our populations or from people that we know, but to be able to have, solid research is just great. Focusing specifically on business outcomes, because that's what you're asking about. Of course, employers are prioritizing financial wellness because employee financial stress can lead to performance issues that directly impacts productivity. It impacts recruitment and retention, and all of those are super important business metrics. And as Charles alluded to, you have to start with pay. Insufficient pay is the number one reason why employees leave an organization. Overall, over half of workers, around 58%, according to our research, consider leaving an organization because their pay is insufficient. And that number actually goes to 75% when you go down to, hourly workers that are earning less than $15 an hour. Pay clearly tops the list as to why employees join and stay with organizations. But in addition to that, benefits and work-life integration and flexibility are all really important retention factors. And I focus on that because that is such a huge business cost to have to replace somebody. But when it comes to productivity, financial stress is real, and it does have an impact on productivity. There's some data that was published by TIA Institute and High Lantern Group that documented that 42% of U.S. adults say that money takes a toll on their mental health benefits, and financial stress contributes to about a 34% rise in missed work and lateness. So certainly a metric that businesses care a lot about. In addition, workers under financial strain are 5 times more likely to be preoccupied with money matters while working and tend to take roughly twice as many sick days or personal days as those who are not financially stressed. There's that concept known as tunneling. When you've got a major problem, it's just really hard for you to focus on anything else. And certainly financial stress would fall into that category. I think that, all the things that have been talked about are really important. The ability to save for emergency life events, to save for future goals and retirement are really vital in preserving financial well-being. I thought it was interesting from research that we do, 61% of workers say that if their company offered in-depth financial counseling and advisory services, that they would be interested. And, I think a lot of organizations do make these types of services available through some of their programs. It may not just be really apparent to workers. And so I think there's definitely a call to action there. We are seeing companies partner with financial organizations that'll offer, free webinars or, other types of support to help employees feel more confident about money management decisions at different stages in life, or one-on-one counseling sessions. Emergency savings benefits that Charles talked about are also just an excellent way to both increase retirement participation and maintain financial security, retirement security. Big fan of the Secure 2.0 provisions and what they enable. Would love to see that for HSA plan participation. If you could contribute to your HSA and still get your 401k match or something like that, I think would be just a great step forward as we think about those types of programs. But in speaking of that, another financial wellness issue is related to healthcare. Healthy workers are more productive workers, but some workers are less confident that they can afford the care that they need. Employees struggle with healthcare affordability across all industries, but low-wage workers, in particular hourly workers, struggle the most. We have a lot of data that document the percentage of workers that say that they're not confident that they can afford the healthcare that they need for themselves and their family. It jumps to 28% for those at or below median wage. It goes to 50% for those that are hourly, in that category, earning less than $15 an hour. And then I'll just add one other thing related to healthcare is that almost 75% of workers say that they have delayed seeking care, most often for financial reasons. And you had a lot of good data in your research about medical debt and the fact that, more robust healthcare benefits, including HSAs, flexible spending accounts, could have an impact there. I think the call to action here is to make healthcare affordable for your whole workforce, not just your medical plan eligible employees. I know that's a tall order, but with everything that's going on, in particular with the individual market, I think it's something that we all need to give a closer look to. I know from our own research that we have seen employers moving towards medical plans that are less costly from a paycheck deduction and also less costly when you need care. They come with more rules and guidelines, maybe a different network configuration, but a lot of good work is being done to try to make healthcare more affordable and more accessible. The last thing that I want to mention is that our research showed that employees who receive more benefits are more likely to believe that their employer cares and to be thriving in their role. And there was a lot in your research around more benefits communication and the effectiveness of those communication. And I think that a really key element there is just how you communicate those benefits and how you connect with your workers. There's a finding from our research that we asked employees whether or not their employer cared about their health and well-being, and we correlated that to whether or not they said that the communications that they got around their benefits were engaging. And for those employees who said that their communications were engaging, there was a 55% difference in them feeling that their employer cared about them and their well-being. And so, it's kind of interesting to think about. You probably have all of the benefits in place, but how are you reaching your workforce and how are you truly having an impact on them with all of the great things that you're already doing?
Super. Yeah, that was a lot of territory covered and a lot of echoing of what we've seen. But I think the communication challenges, every conference I go to, I'm sure Nancy and Ricardo are the same. It's a common question about how to hit people with the right communications and so forth. I will say there was an interesting thing. I was just speaking at an event yesterday where we were talking about some research where we framed the 1,000 emergency withdrawal with an employer partner to employees who weren't participating in the 401k plan as an opportunity to participate. And folks took up that offer in a slightly researched treatment and control environment. So I think there is a lot of opportunity and a lot of testing ground, which is what the focus of benefits for the future is. So turning to you all, Nancy and Ricardo, and I'll start with you on the next question, Ricardo. As human resource leaders, benefit providers, executives watching this webinar, consider implementing or enhancing workplace benefits to achieve financial win-wins that can also, as we've heard from Tracy, improve mental health by reducing financial stress and helping people be present and show up and do their jobs. What sort of advice do you have for folks in that area?
Sure. Thanks, Nick. I would say this may not be revolutionary, but here's the approach that I think really works well. And it's starting with understanding your workforce. I think we're all talking about spending time listening to our employees, understanding the employee experience, their pain points, what's going well, what they need. Whether that's conducting surveys, focus groups, analyzing some of the demographic data that we have available to us or the benefit use data to really understand what they truly need. Asking them is the best way to really understand what's going well and what we can do better. I think we're all talking about the importance of impact. And, Tracy, I know you said that there's benefits to offering a lot of benefit, a diverse spectrum of benefits, right? And that is so important for people to understand those and also to prioritize those that have the greatest impact for our people and helping them understand what those are by telling stories about how people are using them. How do people like me use these benefits in a situation like I'm in, right? And really sharing some personal stories that might better help people understand the impact that these benefits can have on their lives. I think I mentioned on the global workforce piece, really targeting where it ultimately makes sense because we have a highly diverse workforce generationally, culturally, globally, by income. And, really, I think we're thinking more and more about being intentional to specific groups so that they have the relevant benefits available to them, and then they'll take advantage of those benefits as well, right? If again, that ties to that whole persona and understanding like what's in it for me and how am I going to benefit from this. And then finally, an approach that I think we seem to be taking to many things these days is focusing on simplicity, really making benefits easy to understand, easy to sign up for, and easy then to take advantage of, to like then go and, you know, make your appointment and follow up. So that simplicity is super important. And I also I can't echo enough on the communication piece, just figuring out those communication channels that work best to reach your different audiences. You know, and while a mobile text might work well for some, many still really do rely on paper and email versus pulling information themselves.
Yeah, Ricardo, that's such a helpful list and really an important reminder about the different types of communication channels that folks rely on and how they think about where they can and will engage on a day-to-day basis. Nancy, what are your thoughts and advice for folks listening today?
Sure. I think kind of echoing both what Tracy and Ricardo said is my big piece of advice is just to meet associates where they are and acknowledge that one size does not fit all. And I have an example of that, really. We were lucky to have Commonwealth work with us to design and communicate our emergency savings program. And through their research, we really learned that associates have different financial needs and wanted to save not only in different ways, but with different levels of access to their savings. So we designed a three-pronged benefit program to save through, you know, convenient payroll deduction, but either to an ADP Wisely account that had a convenient and immediate debit card associated with it, to use simple split deposit through our payroll system, and then also to have the option to save in an in-plan after-tax account in our 401k plan. And so offering these different options lets associates save in a way that best meets their needs, whether it's, you know, with lower fees or to provide an investment option. So the initial pilot saw more than 4,500 associates participate, saving about 1.5 million across these three offerings. And that number continues to grow. So we're excited to see that. But also I would just say that don't be afraid that by offering an emergency savings, that it will eat up or divert from, you know, regular retirement savings in a 401k. What we saw was that those who started an emergency savings account either kept their retirement savings stable or in some cases even increased their retirement savings. So this trend is really very encouraging, and we hope it will continue as, you know, associates feel more financially secure. And one last similar point, you know, everyone has talked about on this panel that healthcare costs are some of the most pressing financial challenges and that medical costs are some of the highest financial emergency expenses for LMI earners. And so in trying to meet our associates again where they are with our health and welfare benefits, we offer a full menu of benefits so that associates can choose the benefits that most meet their family's needs. And besides, you know, traditional medical, dental, vision, life, and disability, we also offer FSA accounts, NHSA accounts for savings, and we have some supplemental medical coverages. We even offer legal and pet insurance, so we kind of try to cover the gamut. And of course, you know, finding a cure for cancer is a very important mission for AutoNation's Drive Pink campaign. And so we're really intentional with our free cancer benefit. But again, we're trying to be responsive to our associates' needs to provide financial security. And so we offer coverage to help give our associates that peace of mind when these medical events really do happen.
Really appreciate that, Nancy. And I love the notion of that, something that's seemingly as simple as an emergency savings benefit can be a little bit more complicated given the differing needs and preferences of folks. Those who might want something closer to the retirement plan, those who might want something that makes it easier for them to defer $5 or $10 from their paycheck to an account they already like, or folks who don't have an account that they like and don't necessarily want it within the retirement plan. And so meeting all of those needs at once is complicated, but super important. And great to see that it did not reduce retirement participation. Ironically, we know those emergencies end up to rating the retirement plan And so it's good to see that it works a little bit in the reverse. So Tracy, we've got about 3 minutes till I want to get to audience questions. And this is a reminder to the audience, send your questions in for this great panel. And turning to you, wanted to talk about this question about proving return on investment to leaders and stakeholders in management about offering financial wellness benefits that are intentional and inclusive. And so I'll go with a very simplified version of the question we discussed beforehand, but how do you think about employers and how they can move beyond financial wellness from being a nice to have to being really an integral component of what human resources is providing?
You know, I think affordability is the focus of our entire country right now, whether it is affordability of housing, food, basic needs, healthcare, being able to save for retirement. I mean, I just think affordability is the focus. We've got 5 generations in the workplace, as you know, as everybody has said very well. You know, you can't really, it's not a one size fits all. You need to meet everybody's needs. And so I think having meaningful financial programs, whether you're focused on financial literacy or debt management or savings, emergency savings, retirement planning, I feel like you really need to cover it all. And it's probably one of the most important benefits that employers offer in terms of just the financial security, including healthcare benefits. And so, you know, and I don't think that you can assume that it's totally wage-based, that it's your low and moderate income workers. We work with a financial services client. The employees were higher than average pay. We saw a way above average number of 401k hardship loans. And when we did a deeper dive, it revealed that they had a big cohort of first generation professionals who didn't have foundational budgeting skills. And so those types of tools and resources are just super important. I think that, you know, the healthcare affordability, as I mentioned before, just trying to make healthcare affordable for everyone is definitely a call to action. You know, the link to emotional well-being. I also think that, you know, things like caregiver benefits are top of mind in some research that we've done in the industry category of retail, hospitality, food service. Half of the workers in that cohort told us that they either had children that they were responsible for or elder care issues that they were responsible for. And that in itself is also, you know, a big strain. And I'll just close with one thing. You know, I think culture really matters. Burnout is the number 2 reason after insufficient pay that causes people to leave their job. And so I would just say, don't underestimate a culture of caring and leadership support. I really can't say enough about this. I think that when people feel that, it does make them loyal, it does make them more engaged, and then do a really good job communicating your benefits and all of the great things that you do. And, you know, as the case studies that have been shared shows, and you know, with great support from Commonwealth, that communication really does matter when it comes to engagement and take-up rate for these great programs that employers are offering.
Thanks, Tracy. That's a super important point about the connection between financial wellness and how folks feel included and part of the culture of an organization and the overall sense of thriving in the broader workplace. And I think that just underlies how important the work that you all are doing is and how impactful it can be on the lives of folks that work at your organizations and to those that you organizations where you advise. So I want to turn to our Q&A, and the first question I'll send off to you, Nancy, and Ricarda and Tracy, let me know if you want to opine as well. But this month alone, we've seen major employers of workers earning low to moderate incomes cut their workforces with the economic forces at play. Why is now the time to invest in employees with intentional benefits? Nancy?
Sure. So retention of our associates is a super key goal for us, and having a robust benefits program is really an important part of not only attracting associates, but of retaining them. And I think Charles said earlier that 74% of employees would leave a job for better financial benefits. So I think I can take healthcare as an example of what this statistic really means for employers. And with the rising cost of healthcare, we as employers are really challenged to be more efficient with our health benefit dollars, to minimize the effect of these rising costs as much as possible, since we don't have, unfortunately, an unlimited benefits budget. But at AutoNation, we're trying to meet this challenge by, one, encouraging prevention, offering centers of excellence, and providing the educational opportunities to help our associates choose where their next benefit dollar should be spent, which is, I think, a challenge for our associates. Benefits discussions get more and more confusing every day, not only for benefits professionals, but certainly for our employees and associates. And whether it's retirement or healthcare or other supplementary offerings, it's confusing. But helping our associates navigate their benefits landscape is really an effort well spent to show that they are valued. As Tracy, reiterated, it's super important to our associates to understand that they are valued and that they have the resources they need when financial or health emergencies arise. But absolutely no doubt, communication of these benefits and resources is a challenge. For example, for us, our associates are spread out among 300 locations throughout the U.S., and they may or may not be, wired to their computers. So our work with Commonwealth on the emergency savings took this really reality into consideration, because we developed a multi-channel communication strategy tied to health and welfare annual enrollment. We included benefit spotlights, in-person events, email campaigns, print communications, including materials that were designed for our non-wired employees. So Tracy, we'll take the challenge and the statistic about how important engaging communications are to our associates, and we'll, revisit everything and make sure that we're meeting that challenge. That's an important data find that I will definitely take to heart. But we learned that employees needed multiple reminders to help them sign up for benefits. And also that one-on-one support is super helpful for employees to really navigate the benefit offerings. So we're constantly working with our vendors to increase engagement and to pilot new ways to help ensure our associates really understand the value of their benefits, as Tracy, you brought home. And of course, we're very grateful to continue the work with Commonwealth as part of the Benefits for the Future initiative supported by JP Morgan Chase. It's been super helpful to have access to your research and seeing what other companies have done to really drive home the message of value in our communications.
Super, thanks for that. And I think that there's another question that's come in, and I think it's a good one to bring back in Bernadette into the conversation as well. And also, if you have questions, Charles is available and ready and willing to answer. But Bernadette, I'm curious, as Trump accounts emerge, and there was this conversation in the data about folks lacking, access for retirement, but also that interesting finding in the national survey about folks looking for investment accounts through their employers who are low to moderate income is quite interesting. But as Trump accounts emerge, where do you see the role of employers in shaping the use and adoption of this emerging trend?
Yeah, I think they're really interesting. So for those who haven't heard of them, they are tax-deferred investment accounts for children under age 18, and there will be $1,000 seed money deposited from the federal government for children born 2025 through 2028. And what the intention of these accounts are is to further financial literacy, market participation, and economic mobility for the youth in our country. And boy, doesn't that sound aligned with the mission of everything that we've been talking about, here today. And the law also allows for up to $2,500 a year per child for an employer to contribute to the account of the children of their employees, with excluding that amount from the income of, that employee. So, as all of us know as employers, we already spend a lot of money on benefits. Healthcare costs in particular are really crowding out a lot of discretionary investment dollars, giving kind of the rate of healthcare inflation and that sort of thing. But tax policy really can drive where benefits go. And, these accounts seem like they could be an interesting opportunity to offer a differentiated benefit for your employees and for sort of the communities at large, in which we all, work and live. So I think it's an interesting space to watch.
Thanks so much, Bernadette. That's super helpful overview of the opportunity, and we'll see how the space evolves, and hopefully people will be watching. Charles, want to bring you in quickly for a quick 1 minute before I wrap up, but a question came in. What have you seen as a need for impacted benefits like the Secure 2.0 retirement match for student debt repayment? What are your thoughts about that one?
We've been doing research on this one. We think it's a really promising opportunity. You're not seeing widespread uptake yet, but this is actually something we've been talking with employers about. There's a strong interest. It's a great program, a great incentive. So I would say that we're encouraging any employer we talk to take it up.
Super. Well, I just want to take this opportunity with a couple minutes that we have left to thank Bernadette, Nancy, Ricarda, Tracy, and Charles for walking us through the survey, but really have appreciated this conversation, your partnership, collaboration, and your commitment to leadership in this space. There's really an opportunity here for those that are listening to engage in benefits for the future. One step you can take immediately is to download the national survey from the Commonwealth website, www.buildcommonwealth.org. And you'll learn all the in-depth supporting information that Charles couldn't dig into, but really tried to highlight in the time that we had together. Encourage you to reach out to us if you have any questions and follow up around anything that you heard today. But once again, super thank you to Nancy, Tracy, Ricarda, Bernadette, and Charles. And everyone, I hope you have a great rest of your afternoon, a wonderful weekend, and a superb Thanksgiving.